Hello, my name is Dylan, and I'm the creative director here at Silicon Valley Orthopedics.
Hey, I'm Dr. Masi Reynolds, orthopedic surgeon, sports medicine specialist, and co-founder of Silicon Valley Orthopedics.
And today we're here to talk about the shoulder, specifically.
The rotator cuff.
Did you say the rotary cup?
The rotary cuff. No, the rotator cuff.
What is the rotator cuff?
Sometimes called the rotary cuff. So the rotator cuff is actually a series of muscles and tendons that actually go around the shoulder, originating on the shoulder blade and inserting on the humeral head. And there's actually four of them: the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. And there's a test after this, Dylan, so make sure you remember that.
I'll make sure to study. Okay, so there's a lot of muscles involved with this joint.
Yep.
And all four of these muscles together are called the rotator cuff.
That's exactly right.
Why does all this matter?
It matters because without a rotator cuff, our shoulder can be very painful. We can lose function, we can lose motion, we can have weakness. And unfortunately, it is a common area of pathology. A lot of times patients can injure or tear their rotator cuff.
What can one expect with symptoms when you tear your rotator cuff?
Rotator cuff tears typically aren't so much traumatic. They're what we call attritional. So sometimes they happen, or most of the time, I should say, they happen over a long period of time, either with repetitive activity. So a lot of times my laborers who were working overhead quite often, or a big part of their life, or overhead athletes, swimmers, surfers, baseball players, that sort of thing. Absolutely. And it typically starts as pain and then progresses to pain with weakness and eventually sometimes gets to loss of motion.
Okay, so we got the symptoms down. Now, how does one know that they tore their rotator cuff? How do we diagnose this?
Diagnosis can be either on physical exam, meaning we can actually test the specifics of the rotator cuff, whether it's the top one or the front one or the two in the back, just by simple strength test, range of motion, etc. But we really need an MRI to assess the integrity of the rotator cuff.
All right, so once we have the image, that MRI, we have the full picture, maybe the patient story. What are my treatment options when it comes to rotator cuffs?
We try to start as conservative as possible, especially with partial thickness or low grade, we call rotator cuff tears. We want to try to strengthen the shoulder as much as possible. And there's very specific ways we go about doing that through physical therapy. We want to balance that shoulder and make sure that our shoulder blade and everything is working. We call that scapulothoracic kinematics or dynamics of the shoulder. And so physical therapy, sometimes injections in the form of either platelet-rich plasma or bone marrow aspirate concentrate are very helpful for rotator cuff tears, both in function and pain, range of motion, etc. But if you fail conservative treatment options and you're not improving with these modalities, there are surgical options to repair the rotator cuff.
Well, it's nice to know that it sounds like we have a lot of options to consider when approaching this.
There's always options.
What does that surgery look like?
We can actually repair the rotator cuff all arthroscopic, meaning no big incisions, everything 3 to 4 millimeters in size. And it's called an arthroscopic rotator cuff repair. What we do is we actually get the tendon back down to bone. And the way that we do that is there are little small suture anchors that we can put into the bone and then pass the suture through the tendon itself, tie it on top, and secure that tendon back down to bone. And that's called an arthroscopic rotator cuff repair.
What's the recovery look like from something like that?
We have to let it heal, meaning we have to protect range of motion in certain planes. We have to protect you from strengthening or moving the arm as well, and that's through physical therapy. We start passive range of motion right away. That first 6 weeks is what we call that protection phase, and then we gradually increase from there. For the rotator cuff, sometimes it takes a little bit longer, so we typically say 6 to 9 months for 100% recovery, and usually 80% by 5-6 months.
Well, if someone out there thinks that they have this issue, what do they do? What's the next step?
Yeah, if you have shoulder pain, loss of motion, difficulty sleeping, a weakness in that shoulder, give us a call. I mean, I think next best steps are evaluate the shoulder. Hey, let's get an MRI. Let's take a look at it and let's talk about your options. Let us know how we can help.
Awesome. Well, thank you.
Thank you.
That was perfect. That was perfect. Yeah.
You can edit that one.